Hello and welcome to the Health Tech Marketing Show Live. So the Health Tech Marketing Show is a weekly podcast and it's a video brought to you by my firm, Health Launchpad, and our awesome partners at HIMSS. So I can't think of a better way to kick off this year than to dive into a question which is certainly on my mind, which is what are the big HIT trends, healthcare and IT trends in 2024? And I certainly can't think of a better person to help me with this than our guest today, the awesome Mike Miliard. Mike is the executive editor of Healthcare IT News and of HIMSS Media, and a real expert in the space who's been in it for quite a while. So with that, I'm going to welcome Mike to the show. Mike, welcome. Nice to see you. How are you doing today?
It's great to be here, Adam. Thanks for having me.
Why don't we start off? Tell us a bit about yourself and what you do, the outlets that you oversee.
Sure. Yeah, as you mentioned, I'm executive editor of Healthcare IT News, which is the kind of flagship brand of HIMSS Media. There are 3 information brands, HITN. In addition, there's Healthcare Finance, which covers healthcare financial executives and all the challenges they're dealing with: revenue cycle management, accountable and value-based care, analytics, payer-provider relations, capital finance, that type of stuff. They're aimed at the CFO, CEO, COO audience, and that's overseen by my colleague, Susan Morse. And Moby Health News is another of our brands focused on kind of digital and connected health, consumerization, patient-facing apps and wearables, mobile devices, digital therapeutics, investment. They cover the VC space in Silicon Valley, and that is overseen by my colleague, Jessica Hagan. And so here at HITN, this is our 20th year. As I mentioned, we're the flagship brand. This is our 20th year, and I've been on board for 14 of those.
Wow.
I can't believe it. Yeah, and we cover, obviously, information and technology with a focus on the kind of people and processes and policies and technologies in the provider space, primarily hospitals, health systems, practices, how all those organizations are using technology to deliver better care at lower cost. We're focused on CIOs, IT directors, CMIOs, CNIOs, CISOs, chief data officers, all that.
All that crowd.
Yeah. So we've got our website, we've got newsletters. Government Health IT focuses on policy. Cybersecurity Checkup, obviously, focuses on privacy and security. Telehealth Connection focuses on virtual care. And then in addition to all that, there's HIMSS TV and there's HIMSS Cast. So we've got our own podcast as well. Those are weekly and HIMSS TV is daily. So we're busy over here, and we cover a lot of
stuff. It's global, right? So you're reaching, I imagine, tens, hundreds of thousands of people.
Yeah, a lot of folks, because everywhere across the world is all dealing with more challenges and trying to deliver healthcare more efficiently and with better quality.
Yeah, I always think that people immediately associate HIMSS with the global conference, which is fantastic. But that's probably 30, 40,000 attendees. You're reaching multiples of that. All right. So let's dig in. So what are you guys following? What do you think are the biggest stories that you're going to be following this year? What are the big trends?
Well, it may come as some surprise, but the one that we are obviously focused on is this kind of way out there sci-fi concept known as artificial intelligence. So you may have heard of it.
Yeah. I'm not sure. I'll have to look that one up.
Yeah. It's obviously transforming everything around us, not least in healthcare. There's huge promise, but also not a little bit of risk. And it's got to be deployed wisely and safely and transparently. It's evolving fast. I think, obviously, we are dealing with all sorts of healthcare organizations using it in all manner of ways. Everyone I talk to, typically, I was just out in San Diego at our AI Forum event in December. Everyone I talk to is similarly kind of interested and challenged and kind of trying to throw their arms around how to do this the right way, but they all seem to be taking very deliberate and judicious approaches to the use cases they're tackling and the projects they're trying out and how they're scaling them up. So there's obviously a lot going on in that space.
Yeah, absolutely. And what are kind of some of the key use cases? I mean, AI touches everything. What do you think are kind of like the ones that are sort of the big moving use cases, and the other ones that are maybe a little bit further out there?
Well, yeah, Chris Ross, the CIO of Mayo Clinic, used to say this, he used to make this distinction between big AI and little AI. Little AI, I think, is the one that has the most promise in the near term and is showing the most staying power. Automation, like just automating tasks, like small, like kind of little busybody tasks that otherwise are preventing clinicians from really doing their jobs. whether it's documentation, natural language processing, stuff like that.
Mhm.
And then you can get into huge patient critical use cases like modeling sepsis risk or readmissions to hospitals. And there's huge opportunities there, obviously, but there's obviously, you want to do that right and have your models trained on just the right volume and quality of data. That's happening at some of the larger health systems for sure. And I think it will more in the future. But I think in the near term, most folks I talk to are curious about using generative AI for patient engagement and automating clinical tasks and stuff like that.
Right. So having basically kind of that ambient AI, having the AI basically listening to the conversation with the patient, and it has to be with their approval, and then documenting it, structuring it, and putting it entering it into the EHR, right?
Mm-hmm. Yep. Yeah. Exactly.
Right. And what is you mentioned sepsis? What's the use case there? Is that alerts and things like that?
Sure. Like if a patient is hospitalized and have had surgery, for instance, it's conceivable that an AI model could take data on that patient's health profile and their age and all that kind of personal data and calculate their risk of potentially getting a dangerous healthcare acquired affection. But there's been some challenges with some of those models, as some folks have probably read. But there's just no end to the different shapes and sizes of use cases for artificial intelligence in healthcare. And I think one of the big things as we look towards the year ahead is there's going to be a lot more regulations and policies coming down. The White House just this past, I think it was in October, put out a big sweeping executive order that had it was broad, but it had a lot of healthcare implications. Obviously, the FDA is hard at work with some of the stuff. The Office of the National Coordinator just finalized a rule focused on certification in health IT for AI transparency, right, and ethics. So there's a lot, but right now it's kind of a patchwork, and how it all coheres, I think, is one of the.
And is that? Do you see that? Let's stay on little AI for now, and then move on to big AI in a minute. But with little AI, do you think that's slowing down the adoption of this? I talk to companies in the space, and what I'm hearing is that there's still a lot of trial, a lot of adoption, particularly around the sort of the conversational stuff, and the ambient AI products. But what about the big healthcare systems? Where they are much more, understandably, more risk averse and conservative in the way that they adopt? Do you think that they're moving in that direction?
They're risk averse, but they're also well resourced. So I think they have the expertise and the, frankly, funding to deploy some more advanced applications. And a lot of the ones I've spoken to certainly are. As I mentioned, Mayo Clinic, they're huge. They've got a big partnership with Google Cloud, and they've got some really cool stuff going on. I've spoke to a bunch of folks out in San Diego this past month who were doing all kinds of interesting things. Some is administrative, some is clinical, some is patient facing, some is for the clinician. I just think most of the people are just taking I wouldn't say cautious, but just a deliberate and iterative approach to how they deploy AI automation.
It's definitely moving. I mean, it's out of the experimentation and pilot phase and into adopting it at sort of the stepping towards adopting at scale. So what is you mentioned big AI. So I'm really curious, what is this little AI? I mean, I get what little AI is, right? It's sort of like one or two use cases. Big AI is...
You think of little AI as just kind of the stuff that your iPhone can do, just little automation, just auto-populating fields or something like that. You're just like making your day-to-day work processes a bit more efficient and easier. Big AI would be huge models trained on big data sets for clinical decision support or radiology, diagnostics, and image readings and stuff like that. Stuff that could have a real impact on diagnostics and treatments for patients.
Right. Much more complex. Much more complex. Okay. So I'm sure we'll touch on AI again. But so AI, that's obviously big story. What's next? What's the next big topic?
Cybersecurity, for sure. It's just a scourge across the industry. Hospitals and health systems are facing daily onslaughts of increasingly brazen attacks from cyber bad actors who are getting very creative and innovative in how they're trying to.
Is that getting worse?
It's definitely seems to be getting worse. It has not been getting better. I think health systems are better at preparing for it and protecting against it and mitigating risk. They're spending more on their IT teams and their security teams to safeguard their data. They recognize that this is not a problem that's going away. They And 10 years ago, we were talking about HIPAA breaches or something that might be embarrassing to get your name in the headlines in the newspaper. But now, as ransomware is seizing up critical IT systems and hospitals are hampered for sometimes days or weeks, it's really having an impact on patient care and patient safety. I mean, we've seen cases where ambulances have had to be diverted because the hospital's IT system's down and the patient died. This was a case in Germany.
Yes, I remember that. Yeah.
So the stakes could not be higher. I think there's a lot of help out there, and I think health systems would be wise to take advantage of CISA, which is a government agency, part of Homeland Security. They've got no end of alerts and updates about what's going on out there with the different hacker groups and ransomware. And HC3 is part of HHS, their cybersecurity division. And there's huge challenges. And I think we can talk about this a little bit more, but there's going to be some more regulations coming down the pike soon. From HHS to help hospitals have some kind of basic cyber capabilities in place, because this has been a huge challenge that's having a big negative impact on care.
Interesting. So, I mean, I was talking to a cybersecurity vendor the other day, and they were saying something which sort of surprised me, which is nowadays, if you're not high trust certified or NIST certified or something similar, but basically those are kind of the two big ones, right? That's price of admission now. So when I had I ran a health tech company, and we were doing secure texting, and it was all encrypted. And we were moving towards becoming high trust certified around the time we sold the company. But that was 7 years in, and it was sort of like, it was seen as it would be good if you had it, but SOC 2 compliance was good enough. And it was starting to become more and more important. These days, apparently, it's like, if you don't have it, they're not interested in talking to you.
Table stakes. Yeah. And the same thing on the provider side. I mean, we hear all the time that compliance does not equal security. It needs to be an ongoing, daily, constant vigilance. And
so, what do you think the government would this be a government certification? What would this be? Because people used to talk about, we're HIPAA compliant. Like, well, that's actually meaningless. There's no such thing as really. There's not like a HIPAA stamp of approval. It's a best practices.
Yeah, I think what's going to be happening soonish, and the exact details of the rule are not defined yet, but I think there may be some funding related policies put in place by HHS that you're not going to get government funding unless you've got some basic security capabilities in place. Now, hospitals clearly most of them are pretty cash strapped these days. The margins are tight, and healthcare is a challenging space to be operating in. And they're pushing back, saying, why should we be on the hook for this endless onslaught of cyber malfeasance? But I think the shape that takes is going to come into focus, I think, in the next few months. But HHS just this past month put out a notice, voluntary healthcare performance goals, and it says it's going to provide resources to incentivize better cybersecurity practices. Itself is working on an agency-wide strategy for enforcement and accountability, it says. So we'll see what it looks like. I think you should definitely pay attention and read Healthcare IT News as we
do. Make sure to spread the word. Okay.
But, yeah, we've seen some stats right now from HHS. 93% increase in large breaches reported to the Office for Civil Rights in 4 years between 2018 and 2022. A 278% increase in breaches involving ransomware. So that just shows you right there.
Scary. That's really terrible. All right, so we've talked about AI, we've talked about cyber. So what about the I word? What about interoperability?
We're getting there, but we've been saying that for a long time.
What does that mean?
Well, as I mentioned, I've been with HITN for 14 years now, almost.
Yeah.
And we were writing about interoperability back in 2010, and here we are still in 2024 still. But there's been certainly progress. I mean, at least just the digitization of data to be interoperable is a long way. I mean, back in 2011, just 28% of hospitals had an electronic health record, if you can believe that. And it was barely more than a decade ago.
That's incredible.
Now yeah. I was doing some research for this, and in 2014, ONC put out a 10-year vision for an interoperable health IT infrastructure. So here we are in 2024, which was their goal. And they call for individuals, care providers, and communities to have an array of interoperable health IT products and services to allow the healthcare system to continuously learn and advance the goal of improved healthcare.
It's adorable.
It was a nice sentiment. No, that's not to say we're not there. I mean, we have a lot of that for sure.
Yeah.
And there's been huge advances. There was the 21st Century Cures Act that was passed by Congress in 2016, and that directed ONC to kind of establish a framework for secure exchange which is done. I'm sure folks have heard of TEFCA, the Trusted Exchange Framework and Common Agreement, which is kind of some core principles and conditions to support electronic health data exchange across different networks. That is now, we just reported on Healthcare IT News recently, is now ready to go live. There's 5 qualified health information networks ready to, help, organizations exchange data. There's information blocking, which was also part of the Cures Act. There's rules in place now and disincentives in the offing to prevent organizations from hoarding data and not sharing it and not giving patients access to their own data.
Yeah.
There's big technical specs like HL7's FHIR is huge APIs for patient access and for provider directories. There's a lot of progress made, but still some just kind of old excuses. I don't know is the word, but standardization across data formats and coding systems is a huge challenge. Obviously, information blocking still exists, even though it's legacy systems across smaller hospitals that don't have the kind of technical infrastructure to enable it. HIPAA obviously makes any healthcare data sharing a challenge, and then there's just resistance to change and inertia and all that. So there's a lot of progress made, but there's some hindrance too. Yeah.
So it's interesting. I mean, you mentioned 2014 is kind of when it started. Now we're at a universal adoption of EMRs. Where do you think we are on that interoperability curve? Are we halfway there? Are we,
It's so hard to say and conceptualize, especially when you're talking about something as vast and complex and variegated as healthcare. But I definitely think we're closer to it being a reality, seamless learning health system, as once he put it, a kind of seamless flow of information. We're getting there. We're definitely in a better spot than we, certainly could have dreamed of 10 years ago. So
right. So any other, AI, cybersecurity, interoperability, they're kind of like the big theme. Those are the big themes. Any other major themes that you guys are saying, this is something we're really paying a lot of attention to?
Yeah, obviously telehealth is huge after years of underfulfilled promise. I think obviously the pandemic clearly showed its worth. Patients like it, folks don't like it. Health systems see the value in cost savings. There's obviously just hugely wider acceptance since the pandemic. We're covering telehealth in all its shapes and forms. Hospital at home programs are finding favor in some larger health systems to kind of treat some acute cases where patients live. Remote patient monitoring is showing some big strides. So obviously we've got a whole section on telehealth. We got a newsletter on telehealth where we're covering that on a daily basis. So there's a lot going on there with virtual care. That kind of dovetails with the reason we're all doing this is population health, patient engagement and experience, health equity, access to care. There's a lot of cool technologies out there, but they don't mean much if you're not delivering better care to the people who need it most, underserved populations and the people who need chronic condition management and better health and wellness. So there's a lot of cool efforts going on towards social determinants of health and health systems being smart about working with community groups and transportation, your Ubers and Lyfts to get folks to their appointments, and working with food banks and community centers and other sites of care. So there's a lot going on in that space. And then
just so to come back to, so you mentioned health equity, and it's a really interesting topic that to me. And the reason why I say it is that I've heard it for a while, and I would say that the first time I really heard it was about 2, maybe 3 years ago, and I was like, I'm not really sure what does that mean, and I kind of thought the person who was telling me didn't really know what it meant either. And I've done some for a client and doing some research on this, and we found that we would talk to executive and healthcare organizations, and they'd say, it's very important. But when you'd ask them to define it, it was sort of all over the place. What do you think? What does health equity mean in your terms? And is this changing? Is it really? Is it real, or is it something people pay lip service to?
I'm going to cheat a bit, and I just looked it up. The CDC defines health equity as
you lucky, but you're lucky I rounded up with my question.
The state in which everyone has a fair and just opportunity to attain their highest level of health. And obviously that's easier said than done, but but that's what we're all doing here. And that kind of dovetails with, I'm going to give a shout out to HIMSS, my own company. HIMSS has a mission statement to realize the full health potential of every human everywhere. And that's a global goal. At HITN, we're mainly focused in the US, but we got global sites focused on Asia and Europe. And so it's a complex challenge. I think different health systems are tackling it in different ways. but that's what we're doing with this technology. It's not just to have fun with the newest and cool gadgets. It's designed for better care, and that's how it should be put to use.
Yeah, building on this notion of you also touched on sort of implicit in what you're talking about with telehealth about consumerization. And so actually, I'm going to bring in a question from Bob Lount here, which is, so how's the ever expanding world of non-traditional healthcare companies? How's that impacting healthcare? What are you seeing there?
In a big way, yeah. And I think it's forcing you traditional players, your old-fashioned, for lack of a better term, hospitals, health systems that have been around for years are seeing the competitive nature of some of these entrants into the race. For a long time, some of these big companies were having a hard time getting into healthcare because it's such a unique space and so regulated, and you need to have such specific competencies to succeed. But yeah, for sure, Walmart and CVS and Amazon, or all these folks are really kind of changing the calculus as consumerism becomes, it used to be a buzzword maybe, but now it's for sure, it's changing the focus of where people are kind of strategizing and putting their resources.
Yeah, absolutely. Okay, this is good. There's some other comments here, actually, I just want to pull in, which I thought was sort of interesting. So there's one here from John Moore, well known to many of us. At least, and this was about interoperability, at least we have US CDI version 3 being mandated for 2024, being HTI1, first real national step towards interoperability.
Yeah,
there we go.
Sure.
That's great. Yeah. And then I thought this was pretty interesting, a sort of like a bit of a rant actually about the issues with telehealth is that large systems are building their own programs from scratch, and it's millions of in expenses to get up and running. I've worked with some telehealth vendors and have seen that firsthand. Yeah. But it's a bit like AI in that there's an inevitability to telehealth. I think my sense of it is that massive adoption during COVID for obvious reasons.
Yeah.
Then as we came out of COVID, there was sort of like a pause where I think physicians have said, yeah, we don't really want to do that. We like seeing people in person. Right. And then the patients said, actually, we're consumers and we want to see you the way that we want to see you. And I think that sort of re-accelerated it.
Exactly.
Yeah, great. All right, let's talk about what are some of the innovative technologies that you're looking at that you think can really help to improve patient care and outcomes?
Yeah, there's no shortage of them. But the challenge, I think, is that the coolest and most innovative technologies are the ones that are used by the big players who can afford them. And I think, and here's where I kind of confess, I think sometimes we get a bit of a skewed perception because we're writing about the latest and the greatest and the Cleveland Clinics and the Mayos and the Scripps and the UPMCs of the world. And sometimes it's important to focus on community access, critical access hospitals and community hospitals and providers who are still kind of using some pretty basic technologies to get the job done. But that said, there's a lot going on. Obviously, AI is evolving by the minute, and I think it's got a huge potential as long as it's done judiciously and efficaciously with an eye towards transparency and safety and all that. We're seeing robotic process automation. I think precision medicine, which was largely the province of big academic medical centers, is certainly finding its way into practice more with genomic data and CRISPR we're hearing a lot about and stuff like that. Augmented and virtual reality was kind of like a cool little sci-fi thing for a while, but I think there's a lot of potential there and we're seeing more of it used in training and in patient education and patient engagement and stuff like that. What else? Quantum computing is a big one that seems way far in the distance for a long time, but now it seems a lot closer. Cleveland Clinic has a huge quantum computer there, and that's going to really change the game potentially with its computing power. It could also pose some significant cybersecurity challenges as it makes cryptography kind of obsolete, able to, that's a topic for a whole other podcast. But I think there's a lot going on. Obviously, 10 years ago, a lot of providers were afraid to even use the cloud because they weren't sure if it would keep their patients' data safe. But that has changed in a huge way, obviously. And now it's just omnipresent and it's enabling huge innovation in all sorts of ways.
It's sort of interesting. I mean, I actually want to just bring us back a little bit to something which is, I think, is a really good question here, which is about, because you were touching on this about rural health, and this great question from Donna here, which is, can rural health survive? So it's great. Cleveland Clinic's building their own quantum computer. Meanwhile, other hospitals are like lucky if they can afford gauze, right?
It's true. There's obviously mergers and acquisitions as a continuing trend. A lot of hospitals are having to close up shop. And that is something for the policymakers to help out with, perhaps. In some cases, that might be where virtual care and telehealth can kind of step in. And it's never going to be a fix-all, but I think that's a huge question. And again, that could be a whole other topic for a podcast discussion.
We'll have to take you up on that one.
My colleague Susan Morse at Healthcare Finance would obviously have a lot more to say on that as well.
Yeah. So, I mean, let's talk about the healthcare organizations. What are some of the tech skills that are emerging as must-haves for administrative staff, for clinical staff and for administrative staff? What do they need to keep up with?
An open mind, a curiosity, I say, about some of these technologies that are fast emerging. Here's where I can give a plug for HIMSS 24, which is coming up in just a couple months. It kicks off March 11th.
March 11th, right, there you go. I'll be there in Orlando.
I will be too, and there's a lot of cool stuff to see and learn there. I think just knowing about how people in process are obviously going to be more important than technologies, I think is something to say. Technology is important, but the way that it's deployed and the way that clinicians and staff are brought on board, ideally as early in the process of a new deployment as possible. Obviously, there's big shifts in the way care is delivered. We've talked about virtual care and telehealth. We've talked about the huge advances in analytics, whether it's in the back office or whether it's with clinical and on the patient side. Revenue cycle management is continuing to be a challenge on the administrative side. As I mentioned, cybersecurity, everybody has a role to play when it comes to helping to keep health data safe in the provider settings. There's all kinds of core competencies to have, but those are just a few that off the top of my head.
Those are great. Yeah, absolutely. Yeah, I think it's so interesting with what we're starting to see. So, for example, like with AI and the ambient AI, is that one of the biggest questions that the buyers, particularly the larger healthcare provider buyers, is, so how do we get this adopted? So how does it work its way into the organization? How do we train the users how to use what best practices? And it's ever the case, but I think with AI in particular, there's so much mystique around it. I think there are even more questions.
Yeah.
Actually, here's quite a good question, which is like, we talked about all the sexy stuff, but it's like, what are people doing with their existing tools? I mean, what are some of the things that you're hearing about in terms of workflow processes, optimization, like people doing more with what they have?
Yeah, I saw that term EHR optimization, and that is definitely a trend going forward. I mean, these EHRs were primarily 10, 15 years ago were set up as glorified billing systems, essentially. And
yeah, exactly. Yeah.
If they're really going to be used to improve patient care, there has to be some pretty fundamental rethinking. And I think there's a lot of health systems are doing that, especially as AI and automation come into the equation, and as the virtual care is part of the clinical workflow now. We've talked about precision medicine a bit. It used to be that genomic data was kind of just tacked onto the EHR as like a PDF attachment. A lot of health systems, some of the larger ones like Auctioneer, I think, has done some cool stuff getting precision medicine data into the EHR. Social determinants of health had been primarily left out of the patient record, but smarter health systems are making better use of that type of data. So none of this is easy, and it's challenging for clinicians, I think.
And it's lots of small increments, right? So, lots of different use cases.
Yeah, but forward-thinking health systems, I think, are kind of definitely prioritizing some of those areas. Yeah.
So, last question. I'm going to put you on the spot get your predictions. Okay. But before we do that, I do have one last question, which is about misconceptions. So, like, what are the misconceptions? I mean, boy, we're dealing this in politics, we're dealing this in the consumer world, in media. What are all the misconceptions that you find yourself constantly having to debunk, where people just like don't seem to get it right, and there are all sorts of myths about it?
Well, I don't know. I mean, I guess a fundamental misconception might be that just technology in itself can fix an issue. You can just buy a particular software suite or buy a new application and it'll be plug and play and just turn it on and your problems will be fixed. Obviously, it doesn't work that way. You need to have and I think obviously most people, especially in this call, know that, but it requires a lot of planning and committees
Yep.
and clinician buy-in and consulting, and you need to really do your homework on the vendors that you choose. Obviously, you need to, and then it's the way it's deployed and the way people are trained and the change management policies that you put in place to make sure these technologies are put to work in the most effective way. All that is hugely important.
Yep. Great. Okay. Well, actually, one last question. There's a question here, which from Gary Rust. I just want to put this up. Thoughts on this one? What are the latest trends, more specifically data needs in pop health and patient experience?
Sure. Yeah. Well, we've talked about social determinants, and that's a big one. I think ensuring that clinicians are kind of aware of so much of a person's health is determined by the 90% of time that they're outside of the healthcare system, just living their lives, and devices and sensors and wearables and stuff are tracking some of that data, but just communicating with the patient and putting better systems in place to engage with patients with text. I've talked to the CIO at Mass General Brigham, who's doing some pretty interesting stuff using generative AI for patient engagement. There's all kinds of stuff and we have a whole section on healthcare IT news focused on patient engagement and experience, which is a huge component of that as well, that collects all our coverage of that. But yeah, it's core and it's key because you treat the whole person, not just what's presenting in front of the clinician in the exam room. So there's a lot going on. Yeah.
Well, Mike, that's the last question for you. So what are your predictions for 2024?
Well, I think it will surprise no one that AI will continue to be a huge transformative force across the board. I think despite the doomsaying from some quarters, in healthcare, primarily, it's going to be deployed responsibly and safely and judiciously with very deliberative iterations and scaling up. And I think because they understand the stakes to patient safety and they're being cautious and smart. But I think it's going to make some big improvements in the way that clinicians do their jobs, help automate some of the burdensome tasks that detract from the joy of medicine for them. And I think it's going to be very helpful engaging patients in their own care, perhaps. And we'll see some big advancements on the decision support and pop health management side and stuff like that. So that's one. Another would be that there's going to be more regulation and guardrails in place for AI, whether that's from federal policies like FDA rules or the White House executive order I mentioned has some stipulations for HHS to put a mechanism in place for safety. There's groups out there like the Coalition for Health AI and the Health AI Partnership, which are doing great work kind of convening public-private stakeholders, and they're doing a lot of interesting stuff around compliance and certification and guardrails for AI and ensuring that it's deployed as safely and efficiently as possible. Another that kind of combines AI and cybersecurity, I think it's going to be increasingly apparent that AI is a tool used by both the bad guys and the good guys. We're seeing these GPT-enabled phishing emails that look more legit than ever and spoofing.
Yep.
There's going to be deep fakes trying to get people with their guard down to let the bad guys in. But also there's a lot of tools out there getting more efficient, more advanced by the day with advanced threat detection, incident response, the ability to respond to network breaches and threats in real time. So AI is going to have a big impact on both sides of the cybersecurity equation. Another prediction, which I already talked about, was there's going to be more requirements for hospitals from HHS and CMS about cybersecurity readiness and having some basic digital security defenses in place if they want funding and reimbursement from the feds. And then I think we'll continue on the EHR front. I think we're going to continue to see more kind of consolidation. I mean, Epic really seems to be running up the score and getting more clients recently, and their market share is increasing, and it's increasing. Folks are moving to Epic. It tends to be
continuous migration, right? Yeah.
So, but obviously, there's a lot of great vendors out there who are doing a lot of great stuff, and I think they have a place, depending on the size and shape of the organization. That's going to continue to be interesting to see how that part of the health IT equation shakes out. But yeah, there's a lot going on, and we're covering it all. And so I encourage folks to read us and subscribe to our newsletters and
you have a lot of different ways to follow you. Yeah. Any last sort of like if people want to get in touch with you or they want to follow you, anything what should they do? I mean, I know you don't want it's not like you want to get a million emails from people pitching stories because you already get those, but what's the one thing people should do to follow you or follow your publications?
Sure. Well, me and my two colleagues, Bill Sawicki, who's the managing editor of HITN, and Andrea Fox, who's the senior editor at HITN, we're all on LinkedIn. So you can find us and message us. And obviously, healthcareitnews.com is the site, but we've got the daily newsletter, we got the weekly newsletter, we got the government health IT, we got cybersecurity checkup, Telehealth connection, we got all these newsletters. We're all doing HIMSS TV digital checkup spots. I got an ongoing series called CIO Spotlight, where I talk to different CIOs and find out what's on their minds and their to-do lists as they look to the year ahead. So tune into that. The HIMSScast podcast that we share among the 3 brands is always interesting, and that's out weekly. So we're not competition to you. I don't think we could.
No, that's right. We do it very different. We're just doing the marketing bit.
Right. But
I think the niche within the niche.
Yeah. But yeah, we're a media company and we are multimedia. And so there's all kinds of ways for you to follow us and get the information that you need.
Well, Mike, I'm so grateful for you for taking the time today. I know it's really been useful. And for those of you, I've been getting a lot of questions about, will this be recorded? Yes, it's being recorded. And we're going to publish this as a podcast and as a video. It'll be available next week. And I'll probably write, and I will do. I'll be writing a blog post on this over the next week as well. And before we close, I want to let that we've got another episode. My goal is an episode a week with the podcast, and to do a live event like this every month. And so please subscribe. So you can, if you're listening to this or you want to listen to this, Apple Podcasts, Spotify, whatever your favorite podcast application, we're on all of them, I think. And we have a YouTube channel, and you can also follow me on LinkedIn, because you will undoubtedly see this stuff coming from me on LinkedIn. And with that, I'm going to say once again, thank you to Mike Miliard for giving us the time. And thank you to all of you who attended and asked the questions. I tried to get to as many as I could and really appreciate the conversation. And thank you for anybody who's listening to this after the fact as well. So with that, I'm going to bid you all adieu. Bye.